started, so I don't put my big foot in my mouth, how many of our audience are vets? Just so I know I'm putting my Excellent. Okay. How many are veterinary nurses or work in some sort of veterinary nursing capacity? Perfect. And how many veterinary receptionists or other veterinary type staff works within the veterinary community? Perfect. Just so I know who to not look at. Okay. Who I should be looking at maybe when I say certain things. Connecting with the veterinary community. It's a tricky one, eh? I'm a vet. Somewhere on here, I graduated from the Royal Veterinary College in 1999. That only feels like about 5 years ago, but apparently it was 20-something years ago. That's quite a long time. I have worked in clinical veterinary practice ever since. I started working actually in July of 1999 before I even bothered graduating, which was a foolish thing to do because you should always take some time off and go and enjoy the world. Didn't bother. And yeah, so I've worked in clinical practice ever since. I've worked with a wide variety of different species, predominantly dogs, cats and horses, I suppose, overall. I got very interested in behaviour within weeks, really, of being in clinical practice because I kept seeing all these people come in my consulting room and asking these sort of behaviour-related questions. And sometimes it was, why does my dog sleep so much? And actually that's because the dog was sick for some reason. Or maybe it might be, why is my cat not using their litter tray? And so that started me off on a path, into behaviour really early on. And I undertook a number of behaviour qualification and courses. And back in 1999, 2000, well, I'll just say they weren't quite the quality they are today. And so it's been, I don't really like the word, but a huge journey over a long period of time. I still work in clinical practice. I set up my own business, Understand Animals, back in 2007, with a real aim to kind of bridge a gap, I suppose, between published scientific research on animal behaviour and what was happening in the hands-on practical communities, really. That was my aim with my business, and it's now my 15th birthday now, this autumn, which is really exciting, and I can't believe how fast it's gone. I still work in clinical practice, so I still work in a veterinary practice. I still see dogs and cats and rabbits and sometimes horses, and I do some what I call vet behaviour consultations. I do a lot of education, as some of you probably are aware. That's the main part of my business, which of course is predominantly online these days. And I do expert witness work as well, so I get involved in an awful lot of animal welfare cases. And I live with some dogs, which kind of also, I feel, gives me some sort of experience. Though it may be. Oh yeah, and child. That changed my world in many ways, and my whole kind of perceptions on behaviour and sensory development and all sorts of things, which has been fascinating for me. Palmer doesn't bother getting a mention because we had an argument this morning. That's the one you want to get the kiss from at the end of the day. Anyway. So my point is, I have a lot of experience, I feel, of working within the veterinary community. And I still struggle working within the veterinary community. And I hope that's okay to say that, and it doesn't scare anyone up front. But a lot of people who undertake my education, a lot of people I chat with, feel that vets are pretty scary, and they can be pretty, Etsy's nodding going on, pretty unapproachable, pretty kind of rejectful sometimes of the things that we ask of them. Are you taking notes? And I feel that too, okay? So we're all actually in the same place. And Daniela said this morning, which I thought, was really interesting because it kind of never really crossed my mind that there's this hierarchy, which I kind of get on some level, that there are these, dog professionals at the bottom of a hierarchy. It could be, not that there are. And then there's trainers, and then there's advanced trainers, and then there's behaviourists and clinical behaviourists. At the top of this hierarchy are the vets. Well, that's where I feel most of the vets do feel that they sit. But they sit in that hierarchy when it comes to a medical diagnosis and treatment, okay? When it comes to giving out behaviour advice or training advice they're not even on that tree, the majority of them. And I do not mean that disrespectfully. That is not what we have been trained to do. Now, things are changing, and different veterinary degrees, certainly within the United Kingdom, now do offer more and more components that are behaviour related. There's a little bit of understanding of some training or behaviour. But it's kind of, we've ticked that box really, and we asked a few questions about it in a few exams. That's not the same as practically going out and working with dogs on a day-to-day basis. And I say that, I hope, not to make you feel more nervous that I as a vet struggle within my own community to get the right connections and build the right relationships, but actually as a positive. Because you've heard from other people, the important thing is to feel confident within your own skin at what your skill set is. And whether you use some special clever Suzanne kind of diagram of knowing about what that is and what you do as you approach the borders of what you're comfortable with, etc., or how you work it out, that's often a really, really important place to start. What's your skill set? What are you bringing to the table for that dog and their care provider? That's what's really important. If a vet comes to you and says, oh, I think you should take a look at this dog because he's got dominance-related aggression and I think he could really do with a nice bit of sorting out, how does that make you feel, do you think? Do you think that you would feel, well, hang on a minute, is that actually your domain? That's probably how I feel. Yeah? It is how I feel. But of course, so the vet's the same. If we go to a vet and we say, wow, the dog's limping, how did we miss this? We're going to get the same response, aren't we? So, we've got to hopefully start to appreciate which skill set we have as individuals, feel comfortable within that skill set, and then improve our communications set, basically. That's my take there. Why, then I'll stop waffling and get on with the presentation. But why do we need to? Why don't we then just go, okay, I'll tell you what, I'll stay in my box, you stay in yours, never the twain shall meet? Well, because we normally need to connect with the veterinary community for a variety of reasons. Many dogs have pain or disease as a contributing factor, or a coexisting factor which may or may not be relevant, which we don't know yet, to a behaviour issue. And whether we're dealing with that behaviour issue, and we're not here to define today behaviour and training and that whole grey messy area, whenever we think we're trying to attempt to give a new skill set or modify an existing skill set that dog may or may not have, then pain, behaviour, pain, disease, etc. may be a factor. And that might mean we have to actually communicate with the vet that there's a problem. Yeah? There's also a growing awareness, still actually not as large as I would like it within the veterinary community, that some medications prescribed for health issues can contribute to behaviour issues. I'm going to pick on a real classic, obvious one, which is steroids. As vets, we give out steroids on a regular basis, hopefully not that frequently, for inflammatory-based things, predominantly, and that's what we do. And we say, take these pills to make your dog better. And actually, several recent studies have shown what vets aren't very good at doing beforehand is saying to the client, actually, there's loads of side effects. Now, we do tend to say there's side effects, and I'm not going to ask anyone on the spot what the main one is, but it's been done by Notari and colleagues. They've looked at it, and predominantly the one that everyone focuses on is drinking and urinating more. Okay, they make you thirsty, so you drink more, and then you need to drink more. And many vets will say, oh, by the way, if they start drinking more and needing to go out to the toilet more frequently, when they're on this medicine, then that's kind of normal. But actually, steroids make dogs hungry, and if they make dogs hungry, then that might mean that they start to initiate resource guarding, or it might mean that they actually start raiding the bin, or they become coprophagic, or a whole host of other things. They also, for many individuals, impact on their sleep, they impact on their sugar levels, their hunger levels, and other complicated things which I'm not allowed to go into today. It's a totally different subject, which make that individual feel irritable. And so we know that some dogs are on steroids, they have an increased risk of showing aggressive behaviours to another individual, whether it's a human or another dog. That's just steroids. Okay. There are plenty of other medications which might impact on behaviour too. And so if we want to train that dog, whether it's for behaviour change or even just to train a new skill set, the learning of that dog may be impacted by that medication. And we might not know, you're not going to know that. The vet's probably not going to know that either. You know, that this antihistamine medication has actually been shown to have an impact on new learning. So it might just be a question to the vet, could we check? Yeah, is this something that might impact on the dog? Sometimes we're working with cases that are already on psychopharmaceuticals, so these are drugs, medications that are being selected to have an impact on the brain and behavioural outcomes. Or it may be that you're even thinking, there's something bigger going on in this dog, perhaps they should see the vet because maybe they need some medicine. I get that request all the time. You know, trainer, behaviourist, clinical behaviourist has seen the dog and actually they think that the dog needs some anti-anxiety medicine, etc. And you know, and so we may have to facilitate that kind of request suggestion. There are other things though, and I think this is really, really important, particularly at a conference for PACT where the majority of you are thinking of yourselves as wearing your training hats. And that is, prevention is better than cure. We all know that. So if we can do things which allow the dog to feel confident at the vets before they go to the vets, that would be a great thing. And where's the best source of finding those dogs for that veterinary practice? In that veterinary practice. You know, where puppies are coming in for their vaccines or they're being registered, all that sort of stuff. So it's a great opportunity to connect with puppy caregivers. It's via a veterinary practice, local veterinary practices. It's a great opportunity to promote your business potentially because, you know, as vets we do get so many questions about, my dog does this as well, actually, have you got time to explain to me what that is about? Well, it's not my skill set. Or even if we're wearing our ego hat, well, I could probably tell you, but I don't have time. And I haven't ever done any training in this subject at all, but I'm a dog owner, so I have an opinion, says the vet. Because every dog owner has an opinion, don't they? And vets are dog owners too. Yeah? So it's just the way it goes. So it's an opportunity to promote your business if you can make the right relationships. It's an opportunity to educate veterinary staff, maybe as well. Because there's so many things that if we were reinforcing the right behaviour or not reinforcing undesired behaviour, or if we were setting up our environment to succeed as part of cooperative care handling or consensual handling, I much prefer the phrase consensual handling. I don't get consent from many of my patients because I'm going to do something unpleasant to them, but I work super hard to try to kind of work within boundaries of consent as much as I can. We've got a great opportunity to educate staff that those things matter and how they could matter. And of course there'll be other elements as well, you know, I mean I think about cats, which is not really appropriate for today, but you know, I'm forever saying to cat owners, when they're, particularly with, well, when they're kittens, but I do it with adult cats too, if we can teach your cat to take a tasty, sticky treat on a regular basis, when you need to give them a worming medicine or some other medicine, they're not even going to think twice about it. Yeah? It's exactly the same. I saw a client just the other day. She said to me, oh, the dog wouldn't take the joint supplement that the vet had prescribed because the dog won't take tablets. And shock and behold, it was a Labrador as well. So I look at the Labrador and I look at the caregiver and I go, well, do you want to treat this so much? And I was thinking, this is a discrepancy here, isn't there? But, you know, apparently, sensorily at home, when she's not stressed in the veterinary practice, she can pick out a tablet a mile off. So, you know, there are other skills that we might be able to give veterinary staff which will help them with their connections with their clients too. So what options do we have to facilitate those relationships? And I totally understand it's not going to be easy. It's not going to be easy even more so in the current market because vets in the UK, at very least, are under huge amounts of pressure today. And we have seriously suffered through Brexit and COVID, the selling off of private practices into corporates, and all manner of other social, economic, cultural change that's occurred. We do not have enough vets for the number of patients that we have today. There are, or I don't know what it's like where some of you live, but in an awful lot of places across the UK, there are long waiting lists for pet owners to join a veterinary practice now. Vets are phenomenally stressed. So we therefore have to be mindful of that, I believe, and we have to consider the way we approach these relationships with even greater fragility and empathy than we ever have. I don't think the majority of vets want the best thing for their patients. Okay, and I don't think I probably need to say that much louder for this particular audience, but it would seem that the general public think that the majority of vets are in it for the cash.
Yeah.
And, you know, a bit like you are too, I suspect, aren't you? You know? And we're not, are we? We genuinely are not. And of course you're going to get the occasional individual who is, and you know, and fine, you know, it's just differences within individuals. Most of us are there for the pet, but we're really, really struggling with time. And somebody comes to us and says, well, this dog's got this issue, and actually, I wonder if you could rule out all medical problems. It's a challenge because most of us don't have enough knowledge to be able to know what behaviour and what medical issues affect what behavioural issues, and actually, how do you assess that an individual's healthy in a 10, 15, 20-minute consultation? You just can't do that, you know. So it's going to need some very, very careful treading. Some things to consider are that you might want to get to know the practice a little bit better. I don't know, and if any of you do know, you can tell me, please feel free to shout out. But I think in the UK right now, the number of corporate-owned businesses, veterinary practices, is something like 80%. I don't know if you know the figure, that's about right as far as I'm aware. Which means that they're owned by, you know, one of these large corporations, Medivet, you know, all those sorts of things. And that changes the way that some vets are able to work within their practice. Okay, because in effect they're governed by rules that they have to adhere to. They are not able to make always their own choices about certain elements of the procedure. So that might be helpful. It also can often affect out-of-hours care, educations. It might affect who they are allowed to promote within the business, all sorts of things. So, you know, it's worth getting to think about the practices that are in your area and doing a little bit of background research if you feel that that's worth it. Bearing in mind that sometimes the fact that they are owned by a corporate is fairly hidden. So, you know, that can be a bit of a tricky one. You can always ask me about that later if you want to. Who's in charge of the practice? The receptionists. That's who's in charge of the practice. As far as I'm concerned, always it's the receptionists. But who thinks they're in charge of the practice? Definitely the vets. And who might actually be making the rules and making the choices? The receptionists. But normally we call them a practice manager. And so that's worth knowing as well. It might be worth contacting the practice and finding out who you should best initially communicate through. Because it often isn't the vets, because they're doing their medical stuff. And when it comes to training, behaviour, etc., making decisions, that's probably going to happen through somebody else in the practice. Maybe the receptionist. So, you know, it takes a village to build a veterinary practice. It truly does. And of course, we have the receptionists, we have nurses, we may have kennel carers, we probably have got a few vets along the way. And they'll all have their own levels of interest in training and behaviour, etc. They all will be motivated by some elements of it, because I promise you, every single vet would definitely prefer patients who come in and feel more comfortable in their consulting room. Of course they would. You know, nurses would feel the same. You know, but obviously, and receptionists would rather that every single dog who came in wasn't trying to kill the other dog in the waiting room. And they're also the one picking up the phone. People are saying, "Oh, who could you recommend for dog walking, dog grooming, dog training, behaviour, etc." And they don't always know what to say. You know, so you know, there's always scope to liaise with every member of the veterinary practice, but it's best to do that through one port of call, really, and we need to find out who that is. In some practices, that will be a designated practice manager. In some practices, no one's really giving you any kind of you know, feedback except for a receptionist who does seem to bother to respond to your emails. Well, then we start there. Or they may say, actually, we've got a nurse who's really into behaviour already. Great, I might just drop her an email then if I could have her specific email. So that's what we need to think about. Is there already an existing trainer-behaviourist relationship? In the nowadays, where we are predominantly with COVID, is you can walk into most veterinary practices, and sometimes that's a nice thing because you might go in and you might see a display from another local trainer. You might see some business cards that are up, and that gives you a flavour of what's already being offered. And then it's just that you can have a polite chat around that. Is this a general kind of advertising area, or do you only promote particular individuals? And if you only promote particular individuals, is there a route for me to become one of those particular individuals? What information do you need from me? Existing pre-acquisition puppy education, do they offer any of that? Have a look at the website, have a look at their social media, if necessary, pop into the practice. Are they doing any information for new dog owners in any way? Because if they already are, they might not be interested in further input, but if they're not, that can be a great foot in the door. Because when we see new puppies come for a health check, or don't want to say the vaccination word because everyone gets upset about it, but vaccines are good things, particularly when you're puppies most of the time. If they're coming in for a vaccine or a health check or whatever they're coming in for as a puppy, they always want to talk about behaviour. The new caregiver always wants to ask, where should we go for puppy training? Always. I can probably about 90%, 99%. So who do I recommend? And the majority of vets or veterinary nurses will probably make a recommendation based on what they heard the receptionist say. Because they're God, if you haven't that already. You're feeling very special up there, aren't you, the receptionist at the back. Do they offer any education to their staff from a behaviour or training perspective as well? And what might they be interested in? There are so many ways of getting information from their website, social media, making direct contact, to get you a little bit of background research. Because whoever it was just asked the question, I can't remember what that wonderful phrase was, if you don't answer me, you're dead to me. You're going to get a lot of that. So I was in the practice, one of the practices I work in the other day, and a drugs rep came in carrying the obligatory box of chocolate biscuits. I said, any of them vegan? But he glared at me. So I got to Waitrose and get my own then. Anyway, that wasn't what the conversation was about. I just like winding them up. So, I can't remember why I was going to go with this particular. No, I lost it.
You're dead to me.
You're dead to me. Yeah, it was about, so sorry, he said, thank you very much. He said, well, I thought I'd pop in while I was passing because you don't respond to my emails. That wasn't aimed at me, that was aimed at the God receptionists over there. And they said, well, we tried to. And I said, they just go in their junk. Because I do like a bit of archery at lunchtime. And so anyway, I just thought it was really interesting, isn't it? Because when you make contact with a veterinary practice, who picks up the phone? Who picks up the email? Yeah. And that's often a problem because the veterinary practice, particularly your average size, certainly your larger size, some of your corporate-owned practices, the majority of emails probably go straight in the bin because there's so many of them. I'm a local dog trainer, I'm a local dog trainer, I'm a local dog trainer, I'm a local dog, I'm a groomer, I'm a teeth cleaning specialist, straight in the bin. So probably got to stop. No, I'm joking. But you know what I'm saying. There's just so much, and they're so busy. And of course, 10 of those are, I'm really angry at the services you provided. So they've got to be dealt with. It's always that firefighting thing. And so, if you don't get a response to an initial contact, don't think they're dead to you. Think it's worth popping in with some chocolate and plant-based biscuits. and blatantly some gluten-free ones as well. But yeah, so just think about it. I don't think it's worth nudging and nudging and nudging. If you're nudging 2 or 3 times, there's a reason. But if you do it by the same method, it could just be automatic junking. You might just be going into the junk all the time. That thing called post, snail mail, it does still exist. And at least that goes somewhere into somebody's hands. To be honest, people are quite excited to open that nowadays, aren't they? So, you know, hey, look at you all. Imagine popping a biscuit in, how excited they are. So, you know, it's worth maybe thinking about using different forms of contact, is all I'm trying to say. Use their website, use their social media as a bit of a backup to gain some background information. Is this a sort of practice I think it's worth having a better connection with? They're always worth having a better connection with, but if you're surrounded by 10 or 15, who do you prioritise? Yeah, that's really something to consider. Sell your value. How do you become clear about your skill set? Yeah, because I said you have a skill set, whether you are a professional walker, a groomer, a trainer, an advanced trainer, a clinical animal behaviourist, etc. Whichever you are, you have a skill set which is different than the vet. And vets will recognise that as long as it's presented in the right way. You know, you do have enormous value to veterinary practices. So, you know, be clear about your own worth. Be clear about what your skill set is and what your skill set could be to a veterinary practice based on the sorts of examples I've just provided. Do you run puppy classes? Do you like to do one-on-ones? Do you like to do confidence, you know, building exercises? Do you like enrichment? Do you like scent work? You know, what kind of impact could any of that stuff have? And then create some very short curriculum vitae. Most vets, if they received a curriculum vitae from a dog trainer and it starts off, when I was 5, I went to, you know, Tottenham preschool, it's probably going to go in the bin pretty quickly. So when I say CV, I don't genuinely mean your life CV, I mean your training CV, just your training CV. You know, what packed course or, you know, like what have you done? You know, and some of it can also include webinars, online courses, etc. Of course it can, because that is nowadays a very, very great way of getting, most of the time, good quality education. So, you know, make sure that you think about that. And you can obviously include practical application of that, which is, I have been working in the local area as a, whatever you want to describe yourself as, a dog trainer for 20 years. Yeah, versus, you know, I have attended the following courses. So if you haven't done a lot beyond maybe some practice education or something else, then there's no harm in adding some practical, you know, history as well. I think, but I'm very happy to hear from the vets and the veterinary nurses if they feel differently, vets would like to be able to help their clients have fear-less dogs. I don't like the phrase fear-free, sorry Americans, because I do not believe any dog or cat's ever going to come into my clinic fear-free. It's not going to happen. I don't go to the doctors fear-free, you know, certainly not if I'm having a smear test. sorry. But even when I'm picking up medicine, I don't know, you just get in the presence of that thing, don't you? It's a conditioned stimulus, eh? And you start to just have the heart rate goes up. I'm only there to pick up some medicine for my mum, and I'm already jittery. You know, so but it's the same for dogs, absolutely the same for dogs. So they're not going to be fear-free, we'll call them fearless. They would definitely normally like to have somebody who can give more advice to puppy owners. Because how often should they go to the toilet? When should I be feeding them? You know, should they be sleeping like this? All of those types of questions. The vet doesn't know the answers to all of them, and the vet hasn't got time to answer all of those questions. But I think we are all as an industry, and I'm going to include trainers, behaviourists, and certainly the veterinary community, missing a trick on adolescent advice and senior advice. If any of you caught my live chat I had with Dr. Capon earlier this week for Canine Arthritis Management's page, we were talking about the use of enrichment for dogs with osteoarthritis, and we had a bit of a, kind of got caught up, as Hannah and I often do, in the middle, talking about how the senior dog market is really just poorly represented. When you go into, you know, Pets at Home or wherever it is, whichever pet shop you use, others are available, then there's not really a good kind of silver pawed club area, is there? And yet, you know, we have a huge geriatric, senior, older population. And, you know, I've seen some pretty sad cases actually this week, which I don't want to think about because I want to burst into tears, when it comes to older dogs. And I just think quite often the caregivers for them, I'm trying really hard not to cry. I saw a guy the other day with his 11-and-a-half-year-old Labrador, and he came in for a health check because the dog just wasn't quite right, you know, and it's our first dog. It's our first dog we've ever had in our lives. He would have been in about his 30s, and we've got a 4-year-old child and a 6-year-old child, and we all love her to bits. And it turns out she's got liver cancer. There are lots and lots of things we probably, hopefully, will be able to do for that lovely dog. She's going to a CT scan tomorrow to learn a little bit more. But he was just desperate for senior advice, and who gives that advice? Who talks about putting down more non-slip rugs and more choices in bedding, and the fact that they pace around more in the night because they're a bit uncomfortable or their cognitive function's deteriorating and all that stuff. All of us can be doing that, can't we? Move on, post-op care. This is another bugbear of mine. Your dog's been castrated, your dog's had her ovaries out, your dog's had a complicated operation on her stifle. Whatever it is, she's now got to stay on a lead for 2 weeks. Yeah? And you need to crate them so that blah, blah, blah. And a little bit like Suzanne was saying earlier, is that person actually going to do that? In fact, I might start using that now at my when I discharge animals. I'm going to get the ruler out. I'm going to follow the nurses around, and I'm going to bring out the ruler and say, so how likely are you to follow all of that protocol we've just set for you? And they'll be like, 10, and it'll be 2. And there's all sorts of barriers, and it's not because they don't care about their dog, they absolutely do, and sometimes the things that we set, like 2 weeks of lead exercise, is just beyond what they feel is emotionally right for their pet. But if I send them home with an enrichment protocol, which they do on the lead, they're chuffed to bits. So there's lots and lots of things like that, and vets could definitely see the benefit in that, and that's a wonderful thing. If they are able to pass over the behaviour and training questions, which is they do most of the time recognise is not in their skill set, they're very happy to do that. It's got to be easy. So I'll give you another ridiculous situation. For 6 months of working for a particular practice, every time I've seen an older dog or a dog with some sort of limb pain, which might be arthritic, I've been handwriting on pieces of paper canine arthritis management website details and handing it to the client, because I don't have time to go into all the details in that one consult. Go there. Lots of wonderful free information. And then I was chatting with the practice owner about 6 months later, and I said, I really wish you'd become advocates, I said, of canine arthritis management, because you've got a lot of geriatric dogs in the practice and blah, blah, blah. And he went, oh yeah, we've got cards in the drawer. I said, I've known this practice for 10 years, right? And I have never seen anyone give out a card. And he went, I'll show you where they are. Off we went to the drawer, opens the drawer, dusts off the top of the drawer, pulls out the full box of cards. And I went, how long's it been there? I shan't mention him by name. And he went, 4 or 5 years. And I went, well, and said that we're not advocating them, are we? And it's busyness. And so if they're not giving out your business card, don't feel too bad, because it's exactly the same. It's not intentional. It's not you're dead to me. It's just, I forget, because I've got too many other things taking up my brain slots. But you do need to think about, well, how can I facilitate the veterinary practice getting my information to the people? To the people. You know what I mean? So it might be business cards, but they probably will get put away in a drawer. They probably need to be on a board that the clients themselves can look at, or there'll be other clever social networking things that I won't understand. No, I don't know. I was going to say, like, do a TikTok thing and link it to something. I have no idea. It's not my domain. But there's lots and lots of things. You might also be able to get some testimonials as well from your work to the practice. And some shared ones would be fantastic. If on some sort of social media, whether it's Facebook or Twitter or whatever it is, this dog's just been recovering from surgery and they were assisted by dog trainer in making a post-operative enrichment plan, and look how well they've recovered. Wouldn't that be brilliant? Yeah. And that's great, because if you can say also you're going to share that, and then that's positive reinforcement to the veterinary practice for doing such a great job, not only on the operation, but involving a trainer, but also it's positive reinforcement for you, clearly. Could we even think about web pages that are dedicated to helping the veterinary community on your own platform? Do you have somewhere where a veterinary nurse, godlike receptionist, whoever it is, can tap in and go, oh, look, they offer the following services for veterinary practices. puppy classes, cooperative care handling, enrichment plans for post-operative stuff, dog walks, check-ins, medication giving, whatever it is your thing. If you've got a first aid qualification, bandage checks, whatever it might be, have that list. Have you got a page like that they can access? So, we've done all those things really. Know which is your best individual to connect with, nurture that relationship. It's like every relationship. You do have to kind of keep feeding into it, don't you? It's no good just making the contact once. I have no doubt that my male boss, if I call him that, who had great meaning towards the canine arthritis management business cards, and I know he feels passionately about Dr. Capen's business. I know he does, but she's not checked in with him. That's I'm not not being rude about Hannah, but it's just that he's just so he forgets. If you don't keep reminding individuals, but then you've got to find a balance between that annoying dog trainer who contacts us every week to ask if we've got any new cases, to being forgotten about. I used to struggle when I co-owned a large practice near London for several years, and I've worked in that practice a long time as well. And I did behaviour consultations in that practice, and the number of times that I would see behaviour cases that have gone unaddressed, and I'd say to the clinician, "You didn't think to mention me?" "Oh, I forgot." In the room next door. I'm clearly a forgettable individual. Now you can tell I'm not because I'm pretty loud. Maybe they deliberately forgot. Maybe that's what it was. But anyway, you've got to nurture that. You've got to find a balance. So sometimes that's about asking them, how long do I leave it before I consider that you're dead to me? How often do you want nudging? But it can be stuff like, I had one of your patients and we did this stuff, and so you send an email and you say, they really engaged with doing this, whatever it is, confinement training or car training or ramp walking training, all these things you can prepare dogs for their later lives, enrichment, whatever it was, and would you want to share it on your Facebook page because it's had some really good feedback, or whatever it is, that sort of thing, because that's a good nudge, isn't it? It's a good sort of way in, really. Do consider your communications and know your skill set. So you saw Zippy. Zippy's 3-year-old Springer Spaniel, lead pulling, paw recall, touch sensitivities, classic Spaniel-orientated case. During a training session, you notice that Zippy often pulls himself along. He doesn't seem to be pushing himself from behind, struggled with some steps maybe. And during the recall practice, you noticed that he seemed to be not moving right on his back legs. Sometimes he was even bunny hopping along. When you ask the clients about that, if they've noticed anything, no, I've not really noticed anything. Oh, but he is pretty stiff when he gets up after he's come home from training. Okay. So, do you contact the vet and ask for him to be checked for hip dysplasia? Do you ask the client to book a consult to check him for hip dysplasia? Do you ask the vet if they might do a pain medicine trial? Or do you do none of the above? Who'd like to vote for A? Who'd like to vote for B? Who'd like to vote for C? Who'd like to vote for D? Okay, so D seems to win. D would be my preference, and I don't think that means that the others are wrong. But the thing is, the first thing we have to consider, we're not a vet. So the words hip dysplasia should not be leaving our mouths unless they were given to us by the client. He's already been diagnosed with hip dysplasia. We could write to the vet, contact the vet, ask the client to contact the vet and say, he seems to be stiff after training, he has some bunny hopping, and he might have some funny gait abnormalities with his back legs. That's it. That's your skill set. You've made those observations. He may have hip dysplasia, but that takes a radiograph and some other tests as well. And a little bit like when I said earlier, the vet contacts you and says, the dog's got dominance-related aggression, what he really needs is a good seeing to. And that doesn't feel nice, does it? The vet doesn't like it when you contact them and say, I think the dog might have hip dysplasia. Because immediately, because we've all got massive egos, all of us, I'm not just referring to the veterinary community, we all have an ego, but just vets maybe have bigger ones. And he says, what do you mean hip dysplasia? I don't think he has. And it was the self-defensiveness that someone else was talking about this morning. The walls come up now. And almost, he might not go looking for hip dysplasia because someone's told him the dog's got hip dysplasia. No, hopefully he wouldn't do that. But you get the picture. Yeah. So it's a brilliant thing if you can write down observations, small, short numbers of observations, not a 2-page report. That will go in the bin, it will go unnoticed. 4 or 5 points that you've picked up in the training sessions or consultation is all that they really need. So don't attempt to diagnose, ever. Well, they've lost hair, they've got fat, and they're really slow and sluggish, they're sleeping by the fire a lot, they're a 7-year-old golden retriever, must have hypothyroidism because I listened to a talk by Dr. Jean Dodd. That's what she said. No, what the dog has got is hair loss and has put on weight and is lethargic and likes to sleep by the fire. Facts. Yeah? Does that feel okay? Because there's nothing that annoys a veterinary practice more, certainly a vet more, than somebody sending in an animal with a diagnosis, just like it would frustrate you too if they gave a behaviour label to a dog. Make sure your communications are simple, keep them short. If you're using referral forms, that can be great, but make sure they're really, really easy. Maybe part fill them in, don't make the vet have to fill in the client's name and address. They don't actually know how to access that information, they've got to ask the receptionist, it makes them look like a dick. That sort of thing. Reports, yeah, if you write a report, keep it short. You know, from a training perspective, you're probably not doing that. If you're a behaviourist, clinical behaviourist, etc., then you may well be. The shorter the better. Sometimes I just write a covering note which goes, I've really simplified this. If you'd like more detail, let me know. They never ask. They never ask me for more information. What a surprise. I always try to make sure that any report a vet gets really is on one side of A4. That's going to be my maximum. Occasionally it slips over, because I like to chuck in some references as well. And that's fine, you know, it's fine. And cross-reference it to, you know, other educations you've done as well if necessary, but make sure it's still simple. Okay. There's this book. I don't know if you've heard about this book. The reason why I'm mentioning the book is because I wrote a chapter about vets and vet handling and disease and pain and behaviour on the impact on dog behaviour in there. So, you know, if you need to know a little bit more about that, you might find that useful. But of course, it's got many, many, many wonderful things in there. I think I don't have a copy. Don't ask.
Your whole box.
Yes. The Dogs Trust are now running these dog care vet clinic workshops, are trying to make inroads into more veterinary practices. I've not been part of it, I've not seen them, so you'd have to do your own investigations, but that might be a useful resource to make some practices aware of as well. And then this is a proper reference from REMA. This is a really easy to read paper, and I think it's an excellent paper. Sort of reducing fear and aggression in dogs and cats in a veterinary setting. It's got some wonderful practical ideas. You should have access to all these slides in an online bundle, yes. So, but yeah, feel free to take a picture if you want to. So that's me. I don't exist on the web apart from in social on Facebook because I can never get around to getting my own webpage. So if you want to find out a little bit more, then you can find me through that Facebook business page. Thank you to Pat for allowing me to speak and say some rude words. I think I will be taking some questions in a bit when we get there.